Hey, everybody. Welcome to another Compliance Capers. Hi, my good friend Betty Hovey from Compliance Healthcare Solutions is here today. Yay.
Hello. Hey, y'all.
All right. It's a brand new month. It's the month of May, everybody. We are done. Bye-bye with those April showers. Compliance Capers this month is focusing on corporate integrity agreements. I know at the end of last episode, I left you guys off with a teaser. I was just going to make you wait for more. And so that's what it is. We're going to be talking about corporate integrity agreements, those CIAs, not the CIA, but CIAs is what we're going to be talking about. So, I thought this really focused in on yet another instrumental, way that the OIG can help procure a settlement type of offer with our various providers and entities. So it's something really interesting. I know it tickled our fancies on this path that we've been on since January, since the start of our compliance capers. So I think that was the main purpose of, what our thought process was here on compliance capers, was really focusing in on the various things that we have available to the public, which you and I are definitely a big part of, in terms of, how we can help our providers and practices use these various tools that are definitely publicly available by the HHS OIG. So I'm hoping our audience is going to really enjoy what we have to talk about for this month of May.
It's my birthday month, too.
Well, it's your birthday month. Amazing. It is also Asian. You're a May baby. Yeah. It is also Asian American Pacific Islander Month. It is also Mental Health Awareness Month. Mother's Day is coming up here in a couple of weekends. So, there's a lot going on in the month of May. So I can't wait. Hopefully, your birthday falls on one of our Compliance Capers Fridays. I don't know. We will have to wait and find out. Oh, it's not?
No.
Oh, well, still. It's still your birthday month. So lots to celebrate. Lots and lots to celebrate. Awesome, Betty. All right. So when we talk about the OIG and their corporate integrity agreements, in general, like I stated a moment ago, these things are developed after a settlement agreement is reached between the provider or the entity. So in general, when you and I have worked on cases like this, I've never been a part of a corporate integrity agreement, right? There is that independent review organization, the IRO, that is most often called upon to help the provider or the practice develop a much more compliant program, practice, a better way of conducting their service lines, right? So, I have been with organizations that have worked with external IROs. And I believe you have spoken to me in the past about entities that you've had to work with that were considered to be the IRO for certain cases like this.
Yeah, I was one. I had a client once that I was not their IRO, but in their corporate integrity agreement, part of the agreement was that they would get all of the staff that deals with anything coding and billing related certified. And so they brought me in to teach, the staff to get them certified. So I didn't have anything to do with the audit part of, what the IRO was doing, but I was brought in to satisfy a part of what was in their CIA, which was reported, of course, back to the OIG. And then I've worked with someone when I was at another firm, and she was an IRO for a practice that was under an IA, because it was a smaller office, which we'll talk about in a minute. And so, yeah, I've been like you, like around it, but I have not officially acted as an IRO.
Right. Great. So that's
for all of us, right?
Full disclosure, but that's a great fun fact. That's absolutely true. We've been circling around these types of CIAs and these IROs for quite some time. Yeah. Now, you alluded to something that we definitely wanted to bring up here, front and center at the beginning of our conversation on the background of these corporate integrity agreements, these CIAs, right? So in general, let me pull up my banner for us here from the OIG. In general, you guys in the audience can find this information here that in general, from what we could glean from the wording on this page, a corporate integrity agreement tends to involve entities that are larger. Like towards the end of this conversation here, we're going to be talking about a CIA because this entity happens to be a large hospital system on the West Coast. So, CIAs are for the larger entities and organizations, those things that are called IAs, which we will be talking about in the weeks ahead, integrity agreements, pretty much the same thing, but it's for the smaller provider, the smaller practices or groups, things like that. And then they also have something called a quality review. And that is one that we are focusing on today at the end of this conversation. And I think it's a really good one, right? Because that quality review has a lot to do with the clinical standards and things like that in medicine that went a little bit sideways or a lot sideways in these types of cases, right? So there really needs to be much more oversight from a quality review organization, in addition to that independent review organization that deals with the claims audits and things like that. But the quality review types of people are doing much more of the oversight of the medical necessity of services, the clinical standards of practice, and things like that. So, in these types of large documents that are constructed, it really is crafted in such a fashion that the entity has to go out and find a qualified quality review organization to, perform this type of oversight work to then send back to the OIG pursuant to the instructions in the CIA document. So I think it's really, really fascinating information that the OIG Corporate Integrity Agreement webpage here that I've put up here on the screen for us is really, really useful just to understand what the background details actually are. Right, Betty?
Yeah. And I think too, because I get asked sometimes from people like, why do some people go under IAs or CIAs and other places don't, and I think if you look at, as we start to go through and talk this month, at some of the things that these organizations and facilities and practices have done, they rise to that level where now you're talking about big civil monetary penalties, and maybe even they're considering exclusion from the Medicare program, so I mean, they've done stuff that, when you look at it, you're like, come it's not like we made some big mistakes, and, or those self-disclosures like we were talking about. So these are not people that have self-disclosed. These are people that were trying to get away with something. And usually, like in the case we'll talk about today, somebody blew the whistle on them. That's the only reason they got stopped. So these are like the more egregious kind of things when we talk about them. And so as part of their settlements, usually it's kind of like that life raft, that they throw in the preserver of like, okay, we're going to give you one chance, but their stuff was so bad that the government now says, okay, we're going to sit in your back pocket now. You can pay it back, and you can say, oh, we're really sorry, but we're going to keep an eye on you.
Right.
So that's really what the CIAs and the IAs and the quality CIAs are designed to do, is to say, okay, no, we're going to watch you now. And we'll talk later about what then the IROs and what all these components are that they have to do to really prove it. That's the thing. It was just like, yeah, we kind of don't buy it. We'll give you a shot, but you have to prove it to us over and over and over for a number of years before we'll say, okay, you're good now. You've learned your lesson, and so that's kind of where we'll see these being brought in. Whereas with other people, you'll see like on the Friday fraudsters, where they settled for this, or they, that kind of thing. If they're like super duper bad though, and it's just in your face fraud, that's when you'll see like they're going to go to jail and, all that other kind of thing. But with these guys, they're kind of giving them a chance. They're like, okay, we'll give you a shot, but you really have to be babysat. So, and it's expensive because the organization has to pay for the babysitter, not the
That's
government.
right.
So,
That's right. That's right, Betty. Yeah, you brought up a really good point there. I'm going to bring this up on my screen on my PDF. You brought up a really great point that CIAs and IAs are for years, right? It's not just something that's quick. You're not just being watched for like 2 months. These things can last for years. Excuse me. And CIAs generally will last for 5 years. And the IAs that we'll be talking about here in the weeks to come are generally for 3 years. So these are for long periods of time, right? And in general, on that webpage, when the audience gets a chance to pull it up, it states right there in the very first couple of sentences that the OIG negotiates corporate integrity agreements, CIAs, with healthcare providers and other entities as part of the settlement of federal healthcare program investigations arising under a variety of civil false claims statutes. Providers or entities agree to the obligations, and in exchange, the OIG agrees not to seek their exclusion from participation in Medicare, Medicaid, or other federal healthcare programs. So just like you stated before, right? They are, extending a olive branch to you. They will not exclude you, right? But you have to be willing to go through and agree to all of these requirements in these very, very lengthy pages that comprise the CIA document. And like we had stated, this goes on for years.
And they can extend them over the 5. That one with that large entity I was talking about was actually longer than 5 years. So they're average that, and usually they try to get out of them in 5, but this one they were pretty shady. So theirs went a little bit longer than that. So, but yeah, I mean, anytime, you're talking years, even for a smaller one, an IA that's like 3 years. 3 years. That's a long time. And it's a lot of money that they're going to be out. But when you look at the alternative of getting excluded from the federal programs, that's kind of, for a lot of places, it's like, well, then shut the doors. They can't survive, to see patients and, that kind of stuff if they can't ever report services to those federal healthcare programs.
That's right. All right. There is a little link there for the audience for the OIG document on the quality of care reviews under those CIAs. So let me.
Yeah, I thought that one was really interesting with
really interesting. Yes.
Because it's not about billing impropriety or
Right.
coding magic into the wrong way, where they're kind of doing creative coding and modifier usage and these kind of things. These are more about the quality of care that they may be doing things that are like we'll be talking about, harmful to the patients, which to me is just worse. I mean, creative coding is one thing. It's at least you're not harming someone, but with these kind of things, the unnecessary procedures and all this other kind of stuff that, so with these, it's on top of, what they're looking at from a claims perspective. It's like, what quality of care are you providing, to this federal health care beneficiary population. So that's like a totally different slant on the integrity agreements. So that one I found very interesting when I was looking at it.
Absolutely. Yeah. So this quality of care corporate integrity agreement, right? They're going to be requiring several different items from this organization. So some CIAs require the provider to retain an independent quality monitor that will look at the entity's delivery of care, like you were saying, and evaluate the provider's ability to prevent, detect, and respond to patient care problems. Other quality of care CIAs require the provider to retain a peer review consultant to evaluate the provider's peer review and medical credentialing systems. And then finally, agreements may also require the provider to retain a clinical expert to review the medical necessity and appropriateness of certain admissions and medical procedures. And that's the one that is really going to be applicable to the case that we're going to be talking about in a bit. But, so there are many different stages that can apply for the quality of care reviews as well. So it's really, really individualized based on the practice and what they did wrong.
Yeah. They and they have them, depending on the type of organization it is. You can see the different specialized areas that they could look at. They talk about the skilled nursing facilities, hospitals. They give like information there about looking for quality of care items to kind of point people into directions, because when you look at the Medicare population, there can be, or there seems to be, a lot of issues sometimes with SNFs, skilled nursing facilities, and nursing facilities where you're going to find some of these quality of care issues. So I think that's, one of those places, if you're like looking for something, that's kind of more of the hot spot for them. But, I think it's interesting too in this, it kind of though does say, if a provider enters into one of these quality of care CIAs, it's not an admission that they provided substandard or worthless patient care. It's not, also though, it doesn't say that they're going to give you great patient care going forward.
Exactly. I love that caveat at the end. I know.
We're just, we're not saying one way or the other.
I know.
They're just entering into this. So
that's right.
But I thought it was interesting when you were reading, the different pieces too, about what type. They can have a QRO, the quality review organization, or they can, so there were like 3 different kinds of different entities or that could be looking at their stuff. So they're very specific to whatever the issue was that turned them into getting into the CIA in the first place. So, more so than when it's a CIA. which I thought was good. It makes me feel good. It's kind of the point I was getting to, in that when it's a quality of care thing,
Yes.
they're even getting down even more into the nitty gritty about what specifically the issues were, and having a subspecialist, kind of taking a look at that stuff then. So
Exactly.
when it's quality of care stuff, they're really not messing around.
Exactly. And I love that, when you're zoomed out far enough, when you have that objective eye, right, you can actually see how to make those types of corrective actions, those improvements, much more objectively and swiftly, right? I see that in a lot of these types of cases, is that, and I've also heard it, that providers, the practitioners just didn't recognize it, right? And again, that's because you're zoomed in so close on the service itself, that you often forget everything else that surrounds it has to be compliant. So I think these types of external organizations, like this quality of care types of entities, I think it's incredible that our providers and practitioners under this type of a CIA have to go out and find them, right? And make sure that they are the proper and specific organizations that will help them perform to the best of their abilities moving forward here for the next 5 to 6 to 7 years into their future, right?
Yeah. Yeah, because they have to announce who their IROs or QROs. They have to tell CMS and the OIG, and they have to be on through to make sure that they have the qualifications to do that kind of work. So, it's not like they can just say, oh, well, my brother is gonna, do this for me, and
no,
they like vet. These guys are vetted that are doing this. So
that's absolutely right. Because then the OIG can come back and say, no, your brother is not qualified to do this work. We reject your offer to use your brother, right? That's a great point, is that you have to use someone who has been approved. It's a dialogue, it's a conversation that goes back and forth between these types of documents, from the organization back to the OIG or the CMS, however it's worked out. But it's a fluid conversation. It's a long process. As we read through these multiple documents that you and I love to go read through from month to month on compliance capers. But it's all spelled out, the minutia of how you have to do things based on these individualized situations and CIAs or IAs or quality CIAs that are developed. I think it's fascinating.
And I think what's good on that link with the CIAs too, when people go look at it, is to understand every CIA, every IA, every quality of care CIA, they're all going to be different because they're specific to whatever the issue was that that organization got in trouble for, that got them to the attention or the scrutiny of the OIG in the first place. But on those links, they also show that they do have some core common elements in them, that you will see. And as we go through for the rest of the month, looking at these different CIAs and IAs, is that, they all can be kind of different. They're all really long, because they're spelling out specifically, and they also spell out like your penalties if you don't do what they told you to do. But they all have certain things. They're all the same, and they do list those out there. Like having the compliance officer or a compliance committee or a compliance department, they tell you, depending on how big you are or what your issue was, where you have to get that. But there's always going to be that compliance thing in there, because it's like, that's what got you here in the first place. If you had this, it wouldn't have happened, and then the standards and policies. which should be part of everybody's compliance program, which we always talk about, what are your policies and procedures? Y'all need to have them, and then employee training, and then they go into, the IRO or the QRO, and what your audit schedule has to be like, because that's all going to be part of these integrity agreements, is that you're going to get audited sometimes quarterly, sometimes bi-monthly, sometimes annually, so they will list out all those specifics, but that's always going to be part of the CIAs and the IAs, is that, you have to look at them. They also put, which I think it's kind of funky, that in each one of these, you have to say that you're going to look at the LEIE list and make sure you're not having any excluded. Well, you should be doing that. You should be doing that anyway. You should make sure you're not hiring people that are excluded from the Medicare programs. So I always thought that one was weird. Like, why did they throw that in there when that's something that should be common? But again, I guess if they're looking at the overall umbrella, like, you just aren't doing anything right here, that they put that in there. So that's something else that they have listed in there. And then, of course, while they're doing that, once the audit comes in, if you're found that you got overpaid, you're going to have to be refunding those things. If you got underpaid, you should be getting that back from the payors. But that's going to be something ongoing on whatever timely basis is stated out in your CIA. And then they have to have those corrective action plans and a plan for how to report things, if the IRO or QRO is looking and it's like, no, this still isn't good. That's built in there of how they're going to drop the dime on you, so to speak. If you're not following along. So, as we go through these in the month coming up, we'll point out different parts in different ones of them, because like I said, they're way too long to go through any one of them. But, we can kind of pick out little things and say, hey, if you go to this page, you can see about the IRO or the QRO or that kind of thing. But they all do have certain things that'll be similar as you're reading through them, but they're all customized to whatever the issue was that organization was having.
Absolutely, Betty. No, that was a great.
I was sorry, that was my rant.
No, that's always a great appreciated rant, because you synopsized, is that a word? You encapsulated the breakdown of the multiple pages that are involved in these written CIA documents. And, as you and I have read through the materials that we're going to be focused on for this entire month, of course, you and I saw a lot of similarities, but as you so nicely specified, everything is individualized, right? And so, because we are the nerds that we are, we've broken down the various documents further and seen the similarities, seen the differences. And again, they're based on the individual entity and what went sideways, right? So that's a great point to transition to our first case that we wanted to briefly talk about today. This is one of my favorite cases that I've come across over the years. I'm going to put up the DOJ press release here for it on Providence Health. This is the one. Yeah, the DOJ press release. This is the link. And so, it is for a large health system in Washington State called Providence Health. And, in general, it had a lot to do with medically unnecessary neurosurgery procedures at one of their organizations called St. Mary's Medical Center. And, on Compliance Capers, we don't like to say the names of these places out loud, but when they are publicly available to us, we do have to briefly just read what we're seeing in black and white print. So it says Providence Health and Services agrees to pay $22.7 million to resolve liability from medically unnecessary neurosurgery procedures at Providence St. Mary's Medical Center. Now, this press release was issued back a few years ago, April 12th of 2022. But again, the education that we find in the press release is still valid. The education and the fine nuts and bolts that goes on in these 6 PDF pages from the press release are still juicy, in my opinion, to this day. There's so much that we can learn from just this one press release and what went sideways over there on the West Coast at this particular organization. Yeah, it was a doozy, but I really, really enjoyed reading it. And then, of course, the subsequent quality of care CIA document that came out, and that's over 50 PDF pages, which, of course, we cannot talk about all of it in its entirety here. But in general, I think it really gives a great background on what not to do and why, and what kinds of laws could be triggered if you're doing things like this. You're inadvertently triggering something and you're not protected by any safe harbor. I know you and I have talked about that in episodes past, and there are many, many more than the 10 safe harbors that were originally conceptualized in the 90s. That's escalated tremendously over the years. So our practitioners and providers really have to discuss their service lines, what they're trying to do with referrals, et cetera, with trusted healthcare attorneys and advisors on their team, because there are so many safe harbors and you have to meet all of them squarely to not trigger anything like the anti-kickback statute. But I digress. But I think this particular DOJ press release is incredible. And I'd love for you to pull some points for the audience so we can dive a little bit deeper on what these 2 doctors A and B did wrong here for this organization.
Yeah, and I thought it was interesting that they didn't name the neurosurgeons either. Usually they call them out, but in this, they're just called them Dr. A and Dr. B. So, unless you're in the skinny, over there in all what's going on, you don't know who these doctors are. But Providence, at first, why to our point we were talking earlier, when Sonal and I were talking about CIA versus IA, they have 51 hospitals in 7 states. So that kind of, tells you on the scale. So that's why this is a corporate integrity agreement in the first place. But they have 2 neurosurgeons that this is centered around, and they just call them Dr. A and Dr. B. But they were, Providence had them under contract that were based on productivity metrics. And they were given financial incentives to perform more surgical procedures of greater complexity. So they were kind of being incentivized, to be doing more complex things and more things. And so, in fact, it says in here that between 2014 and 2018, that one of the neurosurgeons was the highest producing neurosurgeon in the entire system of all those 51 facilities. Wow. And between 2014 and 17, just based on that productivity metric, that Dr. A was earned $2.5 million and $2.9 million per year on those productivity measurements. So they were highly incentivized. But what got me in this release when you read it is that it talks about the fact, and this kind of leads into that's why they're in this CIA situation, is because it says that Providence admitted during these time periods when these 2 neurosurgeons were employed, Providence medical personnel articulated concerns about them multiple times. Some of them saying that they were endangering safety of patients. They were created through their surgeries an excessive level of complications and negative outcomes. They were performing surgeries on candidates who are not appropriate for those surgeries and failing to properly document their procedures and outcomes. So it's not like this was out of the blue. People had been coming to Providence. And then it says they further admitted that they were giving more information, that Dr. A completed medical documentation with falsified and exaggerated diagnoses to obtain reimbursement from the insurance provider. So he was also fudging, the diagnosis so that they would be under the medical necessity. They were performing surgical procedures that didn't meet medical necessity requirements set by Medicare and other programs. They over-operated, so they were doing things that were medically inappropriate at a higher complexity, so they could report more complex CPT codes to get higher reimbursement and, more bonus, and that they were jeopardizing patient safety by attempting to perform excessive numbers of overly complex surgeries. And then it says that Providence further admitted that it eventually placed both doctors on administrative leave, but it still allowed them to resign while on leave and didn't take action to report them to the National Practitioners Data Banks for them to be investigated on their licensure for doing these egregious things. So, I mean, they really were like, okay, it's not like you didn't know, you were told over and over and over. Plus, this whole thing started because if you're looking at this document, if you go to page 3 at the bottom of it, it says the case began in 2020 when a whistleblower who was the former medical director for the neurosurgery program at Providence St. Mary. So they had a key tam or a whistleblower lawsuit filed, and that's kind of what pushed it into this. So if that hadn't happened, how much longer would this kind of stuff have kept going on at this facility like this? So, those kind of things, when you look at them, just kind of show you that push into, this was really bad. And those two physicians should have, been excluded from the Medicare program. Providence, maybe even, looking at them and what they could do. And so they were very lucky, that the government got into this settlement agreement with them that allows them to continue, seeing patients, but they're really, really washing them. But they were paying big time for it. $22.7 million is nothing to sneeze at for, paying out for these things. And, to me, that doesn't count, what their liability may be. I just thought of this coming back from the patients themselves.
Exactly.
Suing them for this. That's outside of that. That doesn't even count in here. But that's kind of what they were doing. And, thanks to this, the key tam, the whistleblower, was kind of brought into light and investigated and found just how egregious it was, which led them into the corporate integrity agreement.
Wow, Betty. Yeah. Thanks for sharing those details with the audience. I think it's rather flabbergasting, isn't it? And disgusting in terms of these are highly trained neurosurgeons, right? Trained for at least 15, 20 years of their lives to, they swore the Hippocratic Oath many moons ago to provide quality care to patients. And that was clearly abused here. Yeah. And you brought out a great point that while I was reading this, I too thought the same thing. What about the patients, right? So many of these poor folks were undergoing these operations at a much higher level than necessary. So many different issues.
And it's your brain.
It's crazy. And grotesque and inhumane and so many more adjectives that I could throw out, but
Yeah.
it's deplorable, right?
Yeah.
This type of behavior should not have been going on, period. It would have been nice to see these folks not ever practicing medicine again.
Yeah.
But alas, that's not happening. So, I thought this type of, deep dive into our first example was a good one because it touches on multiple issues, right? From all of the coding, all of the diagnosis errors, to all of the quality of care, lack of patient safety, et cetera. All of it was really honed in on this one case that we wanted to showcase for our very first episode this month, because the integrity agreement goes on, like I said, for roughly 56 or so PDF pages.
Mm-hmm.
And it really goes into the multiple issues, on what's expected of the terms for the IRO, right? And that's going to include all of those claims review. And the CIA talks about all of these carve outs in the various appendices at the end of the document.
Yeah.
So they dedicate all of Appendix A to the IRO and what they're supposed to do. And when they turn things back over to the OIG to review, then they go into Appendix B and carve out all of the claims review, how that all has to be done in a statistically valid sampling methodology that we've talked about here in Compliance Capers Past. They break all of that down. They also dive deep into Appendix C for the quality review organization. Who are they going to be and what are they supposed to be doing, right? Clearly, this entity is in dire need of quality review to get them on the straight and narrow path. And then finally, in Appendix D, at the end of this document, they talk about the clinical quality systems review. So again, so many different specific carve outs here for this particular CIA, for this entity. Very, very individualized. So, you guys can take the time to read this document at your leisure. I do have a link here somewhere that I will put up. But they spend about 17 pages of this 56-page PDF devoted to the compliance program requirements. And they really dive deep into the multiple bullet points, and hone in on the fine details, again, for 17 pages. And like you were highlighting earlier about the compliance officer, the committee, et cetera, all of the training and education that has to continually happen at this organization. And they go on and on.
Yeah, they need
fine
not
detail.
only just the IRO, but also a QRO. I mean, these guys need everything.
Yep.
And the only other thing I wanted to point out, because that was a great rundown, especially with the appendices, just like with the other stuff we talk about, a lot of times you go to the appendices, you get all like the meat of what's going on without all the wherefores and therefore,
Right.
They also will have stipulated penalties. So that's what you want to, because if
that's in there,
you've already shown that, you're pretty non-compliant to get in here in the first place. So if you go to look, and in this one, this particular CIA, it's on page 29 where they have stipulated penalties. And these are per day, y'all. So when you look at these, so if they fail to comply with section 3.A, it's $2,500 a day. If they fail to comply with section 3.B, another $2,500 a day. So when you look at this,
that's right.
It goes on and on and on.
That's right.
For one of them, it says also if any of them make false certifications or false statements on their behalf under the CIA, it's $50,000 for each false statement that is made. So, that's another thing y'all want to check out is what all those penalties are. So, just like with the treble damages and
Yes.
those other kind of, sometimes it's not even it's the penalties that go along with it. So they put teeth in these things and they back them up, and everything has to be certified that it's met and it's done, or you're going to be stacking these fines up daily on these things and not doing it.
That's right, Betty. You're such a numbers nerd. Yes, everybody, she found all the penalties. That's right. It is on page 29 of the PDF. You're right. And they go on and on and on per whatever statute, section, whatever. They itemize each and every penalty. You're right. It's all documented. And again, ballooned out for this particular entity in 56 pages because, like we've stressed throughout the presentation, they went sideways for both parts, right? Just the regular quote unquote claims and documentation deficiencies, but also above and beyond in terms of lack of patient safety, over use of these types of surgeries to patients' brains. Let's not forget this was neurosurgery.
It's shameful.
It's shameful. And I know you and I could go on and on talking about that from a patient standpoint, a patient advocacy standpoint. But again, that's not the focus of the month of May. But in general, I really do hope the audience takes time to, especially if you are a coding or compliance professional in this specific wheelhouse of the brain, CPT coding and documentation practices for that specialty of surgery. I think these documents are really, really handy and provide a lot of great information for you and how you can do your jobs better. And definitely, of course, this CIA outlines the really basic facts to the general compliance program guidance documents that just came out in November of 2023, which I know you and I love to talk about because although the elements are very similar to what we've seen in years past, this is just yet another example of where the OIG will just put all of this work into the CIA as well. It's just a roadmap that practices should follow. Just use the blueprint, use the roadmap, and practice with more compliance, front and center before you start working too many years into your career. Start off with compliance front and center, and things will go a lot better, in my opinion.
Yeah. And compliance programs, again, y'all, it's one of the things in that 7-element thing you were talking about there, Sonal, is I still, in fact, just this weekend, I got an email from one of my clients who was just like, oh, well, I didn't know we were supposed to, we were talking about, I asked him what was in the compliance program and got that kind of like, what compliance program kind of answer. And I was like, I told y'all before. It used to be it would be nice if you had one, but not anymore, since the Affordable Care Act. If you receive money from federal programs, Medicare, Medicaid, TRICARE, Champion, if you're getting that money, you have to have a compliance program. Doesn't have to be giant and all encompassing, but if you're a one office, 4-doctor, small practice, but you have to have one. So you got to be looking at those elements. If you don't have an idea where to start, go to, trusted consultants, trusted healthcare attorneys, and talk about it. But you have to have one, y'all. You have to have one. Again,
that's right.
But
no, I love it. I love it. You have to do it. It's a must. We sound like broken records from month to month on compliance capers, but it is a fact. Pursuant to the Affordable Care Act, if you accept government payers of any kind, like you listed, Medicare, Medicaid, TRICARE, CHAMP VA, you have to have a compliance program. It's just a fact. So, it might state here that federally it is a voluntary thing. according to the Affordable Care Act, you absolutely have to have one. So it's just a must. So I really do hope our episode today, our very first episode in the month of May on the CIAs, are really going to provide a wake-up call to our practices and compliance professionals out there that, not only do you have to watch out with the services that you're providing, but also from a compliance standpoint, how you can use these types of documents in your own organization to help you draft things compliantly, right? Because like I stated, it is a blueprint. You can utilize items from these types of documents and individualize it for your own practices to help better protect your entity. So, yeah.
Great words of advice, Sonal.
All right, my friend. Well, I think we have come to an end today for our compliance capers. I think this was a really good, comprehensive viewpoint that we provided to the audience so they can be better prepared for our next conversation next week on CIAs. So I can't wait to talk to you next week, my friend.
Yes, same here. Thanks, y'all, for listening in.
Bye, everybody.
Bye.